Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be with us today.
He's out hunting.
He's not hunting.
He's hunting dust bunnies
He's scuba diving with Dive Heart.
in Honduras.
Yes.
And he didn't ask us to go.
No.
Okay. And I'm Jean Marie.
Collectively, we're the host of PodcastDX. On today's show, we're speaking with Latasha DeRamus. Tasha is a TikToker, and we're going to learn more about a condition that she has called Lambert Eaton Syndrome, or Lambert Eaton Myasthenia Syndrome, and we may call it LES from now on for short. But welcome to the show, Tasha.
Hello. Hello. Thanks for having me.
Well, we're thrilled to have somebody else that we've been stalking on TikTok.
Yes. Love the TikTok. Tasha, what exactly is Lambert Eaton Syndrome?
Lambert Eaton is in a family with MS.
Okay.
The only difference is with LES. I spelled it wrong.
That's okay. LES is good. We could keep it at LES.
Yep.
LES. It is basically when your nerves and your muscles does not communicate anymore.
Okay.
It gives different signals, or is a delay in the signals communication area where it basically weakens your muscles, not so much as your nerves, but most of your muscles over a period of time.
Okay.
So I guess the nerve innervation of the muscle isn't working properly, so the muscles end up atrophying?
Yes.
Okay.
Okay. And I guess it's like an immune response, right?
So it's like yes.
Okay.
And then it's like it's not producing the antibodies that your body needs.
Okay. And Tasha, what symptoms first led you to seek out medical care? And also, how long did it take for you to get a diagnosis?
With this, the symptoms, my symptoms, my symptoms started at the age of 15, but I did not know because I was in a marching band and I was very active in high school. So I did not know that my symptoms had started. With the symptoms, it was like achy in my legs. Mm-hmm. So I was like, oh, well, it's because I was very active at the time.
Right.
But when I really started noticing, I was in a car accident February of 99.
Okay.
And September of 99, that's when I got pregnant with my daughter.
Oh.
And I had to stop physical therapy because of the pregnancy. Mm-hmm. So then when I went back, I believe when I was like probably close to the end, 7 months.
Okay.
When I went back just to get a follow-up or whatever. Mm-hmm. We did little basic stuff that I can do, like the walking. And he was like, okay, come back afterwards. You have her. I had her early. I didn't know why, but my heart rate just kept elevating, and her heart rate. So it ended up giving me an early delivery.
Early delivery, yeah.
Okay.
Yes. And like right after I had her, I want to say a month later, I had surgery. And I just started noticing like the aches. And they were telling me I had stomach surgery.
Okay.
It wasn't nothing major, a hernia repair.
Right.
Yeah. But I was very petite. Mm-hmm. And they was telling me, they was like, well, you doesn't look like you just had a baby. And I was like, yeah, no. It was just little jokes, Mm-hmm. And then I started talking, and at they was at 24, they was like, did you have, it sounded like you had a stroke. And I was like, no, they kept telling me I did. Like I started having swallow problems. I cannot, yeah. I started having swallow problems. How do I this? I thought I turned off notifications. Um, and then I started like choking on a small Tylenol, water, food. So then when I went back to the doctor, he sent me to a specialist. And as soon as I walked in and he heard me talking, he said, um, what's going on? He said, don't think like this is how you talk or how you walk. I was like, I'm just real tired. So he had me do some exercises. And he's like, he said, do they think, he was like, on the papers, they think you had a stroke. Do you think you had a stroke? And I was like, no, I don't think it's a stroke. I said, because it's getting worse over time.
Oh, okay.
And I was like, and now it's to the point where I said, because when I first started it, when they thought it was a stroke, I was still able to walk up the stairs.
Okay.
And then a few months later, I started noticing I started walking like a toddler again, like one step at a time, like starting over. And he was like, I was like, that should not happen 6 months, 8 months after the stroke.
Right.
And then he was like, you correct. And then I was in his office and I had to take, I took a Tylenol because my head and stuff was hurt. And it was just a small Tylenol. And I started swallowing. He was like, what's wrong? I'm like, it's stuck. I started choking. They had to rush me downstairs to the ER part so they can get it out. And he was like, I'm going to keep you for just testing. So I was like, okay. So that's what he did. And it took from the time that I started going to him, and that was, he started doing a workup around, I want to say 2010.
Okay.
So from the time I went to him, I got diagnosed with like 4 or 5 months. But overall, it took about 10 years to get diagnosed.
Okay.
Right. What kind of testing did they have to do to diagnose you?
Some of them, they just do the blood test.
Okay.
But some of them do the blood test. They do muscle biopsies. They do to test your nerves. They do a biopsy on your nerves. They do a biopsy on your esophagus. And it depends on what part of the body or muscles is more affected first.
Okay.
And the only reason they do that is to determine how rapid does your muscles weaken.
Okay.
The only reason he said, I'm basically, when I first went, they said I was a rare case. He was telling me that most people with Lambert Eaton, they get symptoms around 50, 60.
Oh.
He said the only reason I got it as soon as I did was because of the car accident.
Okay.
That's what, and then the pregnancy.
Okay.
He said that's what set mine quicker.
Okay. Yeah, that's a lot of biopsies and things to go through.
Yes.
And especially for a new mother, and wow, you are quite the trooper. Yeah, that sounds very challenging. Tasha, had you ever, we had never heard of this before. Had you ever heard of Lambert Eaton Syndrome before your diagnosis? Okay.
No.
Yeah, because we were like, what is this now?
I did research and never heard, and I know it's rare, and every doctor that I saw, I went to Georgetown University, I went to Duke University, John Hopkins, here in Tampa, I went to top good hospitals.
Yeah.
And even with them, when they saw me, they was like, okay, well, we don't know how to treat you because it's rare. And we have to look up stuff and ask for stuff. It was like, we're not trying to blow you off and not trying to act like you're not a big concern. We just do not understand the Lambert Eaton part yet. But with my other conditions, they helped a lot.
Okay.
And the only thing with Lambert Eaton, it's hard, especially if you do not have the carotene to help you, because you will need physical therapy. You probably be in a rehab for a while. You will need speech therapy. You will need outpatient therapy. I have a ventilator. I had a feeding tube. It's a lot of stuff that goes on with the Lambert Eaton because it's autoimmune, and also it's affecting all your muscles.
Okay. Yeah, and some of your muscles you have no control over.
I was just going to ask, does this only affect skeletal muscles, or does it also affect your breathing muscles and your digestive muscles and your heart?
Yes.
Okay.
Oh.
I'm going to start with the lungs.
Okay.
First. With the lungs, I guess it doesn't aspirate like it's supposed. It doesn't pump like it's supposed to. So with some lungs, they say they're supposed to go in and out. Mine, I don't know about everybody else with Lambert Eaton. I haven't really read up, but with mine, it goes up and down.
Okay.
And do you have to use?
Since it goes up and down sometimes, it's still, when I'm laying down a certain way, flat, it fills with fluid.
Oh, okay.
And then it feels like you drowning underwater.
Sure. You are, yeah. Sure. Wow.
So then I have to, first I was on a CPAP. CPAP didn't really help. Okay. So now they put me on a ventilator, but when I'm at night, so when I sleep, it will help.
Okay.
I just got that. But with the heart muscle, it pumps more, so it can get more oxygen out because of the tiredness you feel. So I can do, I'm going to say 5 steps. I have to stop because I get so tired.
Sure.
And my heart rate, at rest, my heart rate supposed to be about in the 80, 88, something like that. Like right now, by me just sitting here and I'm still not moving, my heart rate would be like 120.
Oh, wow.
So then when I get up and start moving around, it jumps to 140, 160. So I gotta be careful with that. And also, my stomach, it does mess with your digestive system. It causes another disease called gastroparesis.
Yes, we've heard of that. Yes.
And that's when your stomach is semi-paralyzed. So with my food, at first I was fine, but then I started noticing little things. When I did the testing for that, your food's supposed to break down 20 minutes before, after you start eating, after you finish eating.
Okay.
My food don't break down sometimes until 8 hours.
Okay.
Between the 8-hour mark.
Okay.
So I had to get a feeding tube. I just got that removed last year in February. Thank you.
Yeah.
Happy about that. But I know I probably need it again, but I'm not,
Yeah, not going to think about the future, yeah.
So it doesn't really affect me because we knew that it was going to probably happen. to my conditions.
Okay.
So, but most people with gastroparesis, when I was reading up on it, everybody that I know that have it, they do have an autoimmune, but most people that I know that have it have diabetes type, I think it's type 1. And that's what my sugar, everything is fine.
Right.
So, but yeah, Lambert Eaton, it does mess with it mess with all your muscles. And I don't want to I don't know what, and with some females, like it mess with everything.
Right.
So some females that have it, they sometimes have to end up with a hysterectomy, which we plan in mind now. I'm not for sure on that part. Like, why do some women who have it gotta have a hysterectomy? Like, I know some parts of it because of the muscles and the cycles, but I'm not sure exactly how does they come together?
Okay.
Like, that part I'm not aware of yet. I'm still trying to do my research on that part.
Okay.
Sure. Well, yeah, I guess those are all muscles that you don't even think about because you're not actively controlling them. They should be automatic, and here they're not able to.
But with mine, I don't know about everybody else, but with mine, I guess it's worse than labor pain.
Oh.
It's the only thing I can actually say it's worse and then when it's like my whole body, when I'm cold, everybody else can be hot. I would be in here with a blanket, a robe. I'm in cold, my whole body. If you touch me, where you touch me at, it would be red. And I would be in tears. And that hurts.
Yeah.
So just any finger pressure against your skin is painful?
Yes.
Oh, wow.
Like if I'm in a bad flare up, I haven't had a bad flare up in about a year or two.
Oh, good.
But if I'm in a bad flare up, it's real painful to the point that I would be in the ER and it would just, they'll be trying to give me stuff that and try to knock me out.
Yeah.
And then they know me very well. So they're like, she don't ask for pain medicine unless she's really in pain.
Right.
And then when I be in tears, they look at my heart rate, or the nurse be like, oh, she just want this. The doctor be like, no, you look at Latasha, she's always smiling. She don't complain. She's laughing. She's on TikTok, Snapchat. She made videos. They said if she's in here and her phone is just over, she's not even looking for her phone, and she rubbing her legs and restless, she's in a lot of pain. They was like, we learned that over time.
Okay.
She doesn't ask me. If she does, it's something real small, like Tylenol, or if she say a Vicodin or Dilaudid, she's semi and like she's in that level that she's trying to break it before she get to the level that she cannot control it. Sure. Like that, you have to watch her.
Right.
Because she don't like, I can't stand pain medication.
Yeah.
Tasha, how has your healthcare team chosen to treat the condition on a day-to-day basis? Is there
anything that
is there anything that can be done on a day-to-day basis, or is it only something that they can treat when you have
symptoms.
A flare-up?
Right.
Okay, so it is medication that they can take day to day.
Okay.
and I had to name a medication. It is, well, I'm looking for that one.
Surdash?
It's like 3, 4. I think it starts with a D. It's like got numbers for 3, 4.
Okay. Oh, so it might be something, you know, I don't want to say unusual, but 3, 4 sounds like it doesn't have a
right.
It doesn't even have like a name yet.
Right. It
okay.
doesn't.
Okay.
And you have to get it from
a compounding pharmacy, maybe. Do they make
you have
it
to
for
get it from overseas? Like you have to get it from Canada.
Okay.
Or you have to be in a trial.
Oh, okay. It's an experimental.
Right, experimental. Okay.
Right. So you have to do that. If you can see it, I don't know if y'all could. It's like 3 dash, 3,4.
Mm-hmm.
I see it's 3,4-diaminopyridine.
Oh,
yeah.
Okay.
Yes,
All
that
right.
one.
Okay.
All right.
Okay.
That doesn't, they haven't approved it in the States. I think it was approved, but it was giving people problems.
Okay.
I'm not quite sure, but I know it's not here no more.
Okay. Yeah, it's one of those things where you have to balance the side effects with the benefits. Huh?
Right. And then like you have IVIG.
Okay.
It depends on your how progressive is your Lambert Eaton.
Okay.
IVIG, that's like an infusion.
Right.
Like with chemo and everything else. I did that. I did there were 3 rounds of that. The first round I did for 5 days.
Okay.
We stopped that. We supposed to did it longer, but we stopped it because I'm allergic. The one I did first time I was allergic to. So I was getting hives and stuff.
Yeah.
So we had to stop that. And then also some people do IVIG.
Mm-hmm.
They probably do it depending on how long you do it.
Mm-hmm.
They try to do it for 2 weeks, at least about 4 to 6 times a year, depending on your situation.
Okay.
And
but
could
it
you
also
do that at
with
home? Sorry.
Yes, you can get it at home, or
Okay.
you can go. In my case, I can't do it at home because I'm allergic.
Okay.
So we do it at outpatient, or we do it at an outpatient infusion center, or we do it in a hospital. And then you have plasmapheresis.
Mm-hmm.
That's when they give you clean plasma.
Right.
I did that 4 times.
Okay.
And I was inpatient with that. You don't have to be inpatient with that one.
Okay.
But the only reason I was inpatient was because I was already in the hospital, and it was easier to do it.
Sure.
Because it make you it make you tired.
Oh.
So, and plus you gotta do that every day for however long they have you do it. So I was in the hospital for a month every time I did it.
Oh my God.
Wow.
Most people, they'll do it coming in and out, and like dialysis. They'll do it, come in and go out.
Right.
And then with Lambert Eaton, not Lambert Eaton, but IVIG is the same thing. Like they'll do it every other day.
Okay.
So it's not an everyday thing. But we did mine everyday thing. So it can, because I had a lot of stuff going on. So we was like, we just about to see how it worked every day. So I did that for 5 days, 2 weeks, I think, 5 days the first time. And then when I did it here in Tampa, we did it 2 days every other month.
Okay.
So it would not give me hives.
Right.
But we stopped that because the only thing about that is when it wears off, it worsen your.
Oh.
It does what?
Yeah, it make you more weaker.
Okay.
So it'll last for about a year, 6 months or whatever.
Right.
But when it wears off, you notice more stuff is getting weaker.
Okay.
So that's why they stopped with me, because he was like, there's no point of me getting more weaker than what I am.
Right.
Okay.
Sure. And does anything help you? And I mean, these might sound like trivial things, but they might make you more comfortable. Like, does massage therapy help? You said that you're always cold. Does like a heated blanket or a hot water bottle help? Does anything make you more comfortable? Even more comfortable pajamas, so that it's not putting pressure on your skin when you're having a flare?
Yeah. So with the pajamas part, it depends on how bad if you're in a flare. Because you don't want to really have anything with elastic or something tight, because it's going to irritate. It's going to put pressure. So, like with me, I have like probably a longer t-shirt. The pajama bottoms, it really don't bother me as much, because now that I lost all my weight, so it really doesn't matter with the pajamas. But I do have some that have like elastics, but they not real tight around my stomach or anything. But sometimes the tightness and stuff, it does help.
Okay.
So sometimes, like,
you need like that compression.
Yes, the compression.
Okay.
It hurts sometimes, but it helps, and especially helps if you have heart problems, because it helps a lot. I didn't know that until I was in the hospital, and when they was saying her heart rate is kind of okay, and then we looked at my pajama bottoms, they said, "Oh, she got the elastic at the bottom, like compression socks."
Oh, okay.
They was like, "That's why." So I was like, so it actually helps.
Okay.
Hot blankets, they help a lot. Weighted blankets help. Heating pads, everything helps. What really helps me the most is hot showers.
Hot showers, okay.
Yeah.
So if you cold, like when I'm cold, I just get in a hot shower, and I just let the water run or whatever.
Okay.
And then when I get out, my body is already warm. So when I get out, it's not as bad as it was.
Okay.
So I try not to take hot showers as much because it dries your skin. But I'll probably, like in the winter, I'll probably take like 2 showers a day.
Okay.
And baby be like, why? Then my daughter, she knows why. So then she'll just, she'll close my door, she'll put heat in my room. She makes sure we're comfortable.
Oh, that's
She'll
nice.
make me warm soup.
That's so
hot
sweet.
tea. Yeah.
Well, yeah, because she basically grew up
knowing how you were
going through
this,
Yeah.
right?
Okay.
Yes. And then I have a service dog, and she knows what to do.
Yeah. What are some of the less obvious parts of your life that are affected by Lambert Eaton Syndrome?
The obvious, less obvious?
Yeah. Like
you were saying swallowing.
Yeah.
And monthly cycles were two that I didn't realize. Yeah.
How is your eyesight?
Oh.
My eyesight.
Because, there's muscles in your eyes.
I wouldn't think of that.
The eyesight it plays a trick. It has its ups and downs.
Okay.
In the beginning, I ain't gonna say in the beginning. Yes, in the beginning, like in 2000, I'm gonna say 2010, because that's when I really started noticing. Like if I'm looking at somebody, or I know it's like when I'm too tired, people think I'm tired, and I'm talking to them, my right eye will start jumping, and then I will have to close it, or I start seeing double visions, and I have to close and sometimes shake my head just to refocus my eyes.
Right.
At night, it don't really bother me too much. I don't know why, but I can focus more in the dark than during the day.
Okay.
But sometimes I do have to have my walker or my cane when I'm walking, because sometimes I can't really see. It just be real blurry. And yeah, some people have glasses. Some people have contacts. Some people, they did say that they started losing their sight here and there. I haven't really did my research on that part about the losing the sight part, but I know I do have like blurry vision.
Okay.
Yeah, I would kind of keep an eye on that.
Oh.
Watch that. Yeah, well, watch that.
Poor choice of words.
Yep. Monitor your vision for your doctor and let them know if you're having worse problems.
Right. Okay. And Tasha, you were saying that your daughter has been very supportive and helpful. What other support have you received during this journey, and how have your family and friends helped you through this whole thing?
So that's gonna be touchy. So I can talk about it.
Well, no, you don't have to.
Make
no. We don't want you to be uncomfortable.
No, I'm not saying it's not gonna be like, it's not gonna touch you like that. Okay. It's just like, okay, with my daughter, she's very supportive. Even though I was always in the hospital and sick at her young ages, but when she became a teenager, she started, asking questions. What's going on? She thought I was in the hospital a lot. She became very helpful. But she was also very active, like cheerleader, gymnastics. She did all that. So when she'll be at school, I'll be at home by myself. And she understood that I was always tired. And I couldn't walk up the stairs like I used to. So she was very helpful. But I still tried to help out as much as I can. I think with her, she just got agitated because I do stuff that I really don't supposed to do. And I risk my own self, hurt myself. So I think that's it. And now that she's 22, she's still here with me. She also get upset now because I do stuff, but I don't do stuff like I used to. But like the cooking, the cleaning, like I do stuff out. But I take my time this time. But she be like, Mom, you don't feel good, lay down. I'm like, you know what, you're right, I'm gonna lay down. Family, some of my family, well, they don't understand how serious this is. So some of them do, they ask questions. Or some of them, they giving me the advice, which I don't get upset with nobody no more when they try to tell me what's going on instead of listening to me. So I don't get upset like I used to. I learned how to control that part. With the friends that I did have, like that I knew personally, I still talk to like 2 of them. But then everybody stopped talking when I started getting real sick. Couldn't go out no more.
Right.
And at the hospital. So that became a problem. But my support team that I have now, it's crazy. Most of them is on TikTok, Facebook.
Okay.
Because I share my stories.
Right.
And it's like if I don't say nothing on one of my platforms, they'll get concerned, like, are you in the hospital? What's wrong? And then some people, they didn't even know about Lambert Eaton or gastroparesis or anything. So when we talking about it, they started learning and they be like, okay, well, I'm having these conditions, these symptoms.
Right.
So what should I tell my doctor? And two people, when I was telling them about it, and they was like, well, my doctor keep telling me it's nothing to worry about. And kid you not, one of them went to the Johns Hopkins Hospital, and within 4 months, she was like, they told me I have MG. I was like, that's another.
Yeah.
I said,
right.
In the same family. And that's the only part with me. We don't know if it's Lambert Eaton or MG because they both related.
Right.
And one associated with a brain tumor, the other associated with lung cancer. I get headaches. I get both.
Okay.
So they don't really know exactly which one is which.
Okay.
But they're in the same family and they can be treated the same way sometimes. But yeah, so it's like they oh, that's Foxy. So, and then like with the I met people that have gastroparesis. They was teaching me stuff about it. I didn't know anything about the feeding tube. Like I was real, like I didn't know what. I got real depressed.
Oh, sure.
And me, my support team, and then my doctors, especially when I moved here to Tampa, my care team is so supportive. Johns Hopkins, I don't even go there no more. And they will reach out to me. Georgetown, they will reach out. Duke, they would still reach out. I have so many people that's amazing. And I never thought that I touched in that way. And they were like, oh, we just want to say hi. How are you doing? What you cooking? And of course, when you get a phone call from a hospital or a doctor's office, you thinking it's something serious, especially if it's like 8 o'clock at night, 9 o'clock.
Right.
You're like, oh my God, what's wrong? What's wrong?
Right.
And then on the other end, it's just like, oh, we just calling to see how you doing. We haven't seen you in the ER. Your name haven't popped up on the board.
Excellent.
I'm like, oh, they're like, yeah, we just saw you on TikTok. We saw your daughter made a homemade lasagna. And I'm like, y'all follow me? I'm like, yeah. I'm like, I never experienced that. So I'm like, oh, okay. So then it's just very, I'm trying not to cry. It's just so touchy.
Well, that's a good, that kind of a team is what you need when you have a serious chronic condition because.
And it's wonderful that you're touching so many lives and you are definitely, an amazing patient leader and it shows. And that's, so we want to applaud you for that.
Right.
It's wonderful.
I have a question.
Sure, go ahead.
I know y'all say y'all edit.
Yes,
stuff.
we do.
Yeah.
Okay. So can I share something? I mean, I just don't want one part. I mean, it don't matter if
we can talk. Do you want to talk after?
Okay.
Yeah. Okay. All right. We understand.
All right. Yeah. And what advice do you have for someone that was recently diagnosed with LES? And what advice do you have, what advice have you received that helps somebody living with a chronic condition?
Advice that I have with someone that have
LES.
That just got diagnosed or with any chronic illness, I'm gonna say, you have to have a good support team, but you also have to stay positive yourself. It is going to be a long ride. It's going to have your ups, downs, and it's going to mostly be your downs before your ups. You want to, I ain't gonna say you going to wish that you were dead, because I never thought about nothing like that. But I heard people say stuff like that before. And if you let that mindset enter, if you let that negativity enter your mindset, that's what your mind is going to do. So with me, my advice is to think of something that's very positive, or have positive role models. With me, I had my cooking. You have to teach yourself with the muscle part. You have to, it's going to be hard because you have to, like you have to teach yourself a whole routine, a different routine than what you used to. Like with the cooking, you have to see which part is your weak and which part is your dominant. Like with my left arm, it's more stronger than my right.
Okay.
My right leg is stronger than my left. And then when I walk with my, like, I walk straight. Like, it's hard for me to bend over and stuff. And that's because I trained myself how to stand and walk so I don't, because I kept falling.
Right.
So, after a while, you're going to train yourself. So you have to train yourself all over again about brushing your teeth, combing your hair, shower, dressing yourself. You're going to have to do a routine that works for you. And like with me, I have to sometimes lay down on the bed and put my shirt on and then get up. And or if I'm combing my hair, I can comb it. But if I go in a certain way, I have to lay down on the bed, do that, because I can't lift my hands up all the way. So with the lifting, you have to train yourself. You have to see your limitations. Like, I know what size of a box I can carry.
Okay.
I know how big of a pot, even with no water or food in it. I know what I can do and what I can't do. So you have to teach it's going to be hard, but you have to learn a whole, even with your talking. And that was the part for me, was the talking and the way you sleep. Like when I sleep now, I cannot move around.
Okay.
So I sleep on my back and I just, move my head. And at first I wasn't able to sleep on my back, but now I sleep on my back.
Okay. Well, yeah,
but I have to, but I have to teach myself how to sleep on my back and how to put a pillow. And I got to keep, like in the hospital, they don't want you to get bed sores.
Right.
So I have to keep moving, certain ways so I don't get bed sores. And with the talking, it was to the point where I didn't want to talk because every time I talk, I feel like I'm getting hoarse or just, so when I'm eating and talking and drinking, I had to learn to eat my food a certain way so I don't choke. I had to learn the medications on how to take it, and also how to because certain medications, they tell you cannot crush. So when I had my feeding tube, I was able to put my medicine in my feeding tube. Now with my medications, they try to give me medications that's either chewable, dissolvable, or that's liquid, real small, or even liquid.
Oh, yeah. Okay.
But some of them, I can't do it that way.
Right.
So the pharmacy, they made it real easy for me. They showed me what to do. Even with the capsules, they showed me the best way is with applesauce.
Right. I was just going to ask about that.
Or pudding, right?
Right.
Yeah.
Yeah. And well, with the pudding,
they
don't really want me to do the pudding because it's kind of thick.
Right.
Okay.
And it gets stuck still.
Okay.
So they want me to do like applesauce, and then I got to turn my head to the left and tilt a little so it can go down. with the drinking, they want me to drink out of a straw more because it's less air and plus it's more it's easier going down. I don't choke with the straw. Well, it's a lot of ways that, and that's the best advice that I got from
excellent advice.
Yeah.
And even off of Google and stuff, I try not to look on Google, to be honest.
Yeah.
Because Google make you feel like that it's
the end of the world.
Yeah. Right. So I really don't look into. Only time I really look into Google is like with medications, but I still do my research. I don't go off of Google. I said, because if you say you coughing, they're gonna say you got cancer. I'm like, you cannot just. And also, my biggest thing that I have learned, everybody that go through the same thing, we don't. Okay, so let's say we all get, if I'm in the room with somebody to get gastroparesis or Lambert Eaton.
Right.
Things that they can do, I probably can't do. Things that I can do, they probably can't do. Like with me, with my eating, I can really eat anything. It doesn't bother me sometimes. Sometimes it does, but it really doesn't bother me. So people be like, okay, well, how come you can eat this much and they only can eat baby food?
Right,
and I'm like,
right,
okay,
right.
everybody is not the same.
Right.
You have to go off. You have to train yourself on what you can and what you can't do. I said, because everybody don't have a feeding tube. I was like, so you have to see what you have to try stuff and see if it works for you. I said, you can't just eat it once and be like, oh, well, it didn't do nothing for me. And then you stop. I said, no. I said, you have to eat. You can't just let yourself, you don't have, our bodies doesn't have the fat or anything that will eat off of if you don't have nothing in your stomach.
Okay.
I said, our stomach is already semi-paralyzed. I lost over 70 pounds with, I was 134 and starting out. When I first got my feeding tube, I was 76 pounds. I lost that weight within 3 months.
Wow.
And they didn't know why.
Yeah.
And that's what I've been telling people. I was like, it's really serious.
Oh, yeah.
No, but I was like, so it's not that I don't eat. It's just at that period of time, I was always off a piece of toast. I was full for the whole day.
Right.
And like, I didn't know why. I said, but now I train my body. Like, even if I'm not hungry,
right,
I'll be like, you know what? I haven't eaten in 3 hours.
Right.
I'm
Eat a little
hungry.
something.
My body just don't know I'm hungry yet.
Right.
I'm like, it haven't connected yet. So then when it do connect, I get real hungry. And then that's when I be real sick.
Yeah.
So I'm like, yeah, y'all have to teach yourself. So
are there any technological programs that you can use to help keep your routine? Like maybe have a timer and say I should eat every 2 hours. And
with me, I have my phone set on a timer. If I'm on a laptop, that pops up to let me know.
Okay.
Like with gastroparesis, it's cute. With gastroparesis, we made our mascot a sloth.
Of a what?
Because, a sloth.
Oh, a sloth. Okay.
Right, because they take 2 weeks for their food to start digesting, and they eat slow.
Okay.
So on my computer and on my other phone, it will pop up. The sloth will pop up, and I'm like, Tasha, it's time for us to eat.
Okay, I like that.
Yeah, I like.
So when it pops up, I'm like, oh, okay. Even if I'm asleep, it don't really bother me when I'm asleep. It'll pop up, but it don't bother me.
Okay.
it'll say good night or something if I don't have no movement. But yeah, it'll tell me when to take my medicine. I take my medicine at night because sometimes it does make you real tired or it make you real sick to your stomach, depending on how fast your digestive system is working at that time.
Right.
So I try to take it at night because if I take it during the day, I'm gonna be no good.
Okay.
So that is very helpful. Also, with the Lambert Eaton, there's a certain time. Well, I ain't gonna say with the Lambert Eaton. I'm not gonna say it's a certain time that you should stop eating and drinking at night, or you should know what it's going to do to you at night. Because
does it come back up?
It sometimes come back up.
Okay.
It can if it sits there.
Okay.
But it will my daughter just came in. I'm sorry.
That's okay.
Thank you. It will, like with me.
It'll what?
If I drink hot tea or anything hot at night after 10 o'clock, it relaxes me so much that it'll give you loose bowels.
Oh, okay. Okay.
So you have to, sometimes you have to, I'm on a medication for that as well. But I try not to take it every day because I don't want to get, too backed up.
Right, right. Yeah, that's...
Oh, I'll probably take it. Depends on my body. So I know I'll take it today for sure. But it will give you loose bowels. So if you have, I don't have no problem with dairy or anything, so I can eat that really. But sometimes it's like your muscles are so weak that you cannot tell when you have to go to the bathroom.
Sure.
Okay.
So some people, like with me,
either
I have a pad on my bed or I have on the pins at night. Or if I'm real weak or whatever during the day, I do the same thing.
Sure.
So even if you out, you have to have something depending on it. That's the only thing with the Lambert Eaton that I notice that it's really hard to control.
Okay.
Is because you can't tell when you have to go.
Right.
And so that's the hard part for me.
Sure.
I don't I still haven't figured that part out. Well, I know what I can eat and what I can't eat.
Okay.
But sometimes
right.
Or I know what time to stop eating.
Okay.
But then sometimes, even if I stop at 8 o'clock, it still sometimes bother me.
Okay. Well, and they might be able to do like physical therapy for that as well. And I want to say there's like a pacemaker for that. Not like but something that can help with that as well, like a stimulation device.
Well, some people do have that.
Okay. And
I guess ones that their stomach is really paralyzed or whatever, they do have a stimulation for the stomach. And some people it doesn't work for, so they had it removed. The only thing about with me is we're gonna talk about that. I'm gonna say that part, but the reason why I'm gonna say that's after we talk.
Sure, yeah.
With me, my body, it holds like I don't know what it is with my body. Well, I know what it is, but like with the feeding tube, the port, all that, even with the IUD I had, my body it rejects it, and I get real bad infections. So with me, they don't even want to try the stimulator.
Right.
They don't want to do none of that.
Right. It's just going to add more trouble.
Because they were like, well, her body can't take it.
Right. Okay.
And with the And I was on so many antibiotics. And people do not understand that either. Because a lot of people are like, oh, well, you can just take antibiotics. No, because the antibiotic, it doesn't know what to kill. It kills the good cells and your bad cells.
Right.
And then you end up with something else because it cannot fight off your immune system anymore. Cannot fight off itself. So I was like, so it's kind of hard. So the only time I get antibiotics is when if I have like pneumonia or something, like if I really, really need it.
Okay.
And they just put me in a hospital and they just give me my IV for a few days. I'm like, we're going to give her a high dose in the hospital, nothing at home. If I have to have it at home, they have my nurse come here for a week. She have to sit here with me for 3-4 hours to see if I'm doing okay.
Okay.
If my heart rate elevated a certain amount, or my body temperature, or if I say I'm cold, she have to call 911 and take me straight to the hospital. When it comes to me now, they did not play around.
Right. That's understandable. Was it hard to get medical care when, I mean, obviously
COVID?
we still have, COVID is still out there, but when there were all of the lockdowns, was it difficult to get medical care and like prescription medication and all of that?
During the pandemic? Quarantine?
Yep.
Yeah.
No, not really.
Okay, good.
Well, yes and no.
Okay.
So, in the beginning, it was.
Okay.
But then it wasn't like they had it. I'm gonna say it was like for a month or two.
Okay.
But then they just started doing everything.
Okay.
I didn't even know they started sending everything to my house.
Oh, good.
They started sending nurses out. And it's so funny that they still send a nurse out to do lab works and everything else. And I'm like, y'all know I can come to the office.
Right.
I'm like, no, we don't need you to come in the office.
Okay.
You're fine. And even with the telehealth, we'll do that. And I'm like, okay. But in the beginning, it was because they didn't want me to come out.
Right.
But I still had to go out. But they didn't want me to go out to so I don't get COVID.
Right. Right. It's hard. Yeah, it's hard to get medical care when the place you're going can make it worse with the
right. And then I end up with COVID.
Oh.
And then when I end up with COVID, it wasn't scary, but it took a lot out of me.
Oh, sure.
I had I came straight on fast. I didn't know, I was one day I was just happy. Then I just got my everything just came. Temperature was 103. So I was in the hospital for like a week.
Oh,
but they didn't want me in the hospital at first because they was like, well, she got other conditions.
Right.
We'll talk about that later.
Right.
But they was like, yes, no, we don't really want her. But then when they did, they kept the same nurses on my team. And you really have to go in there. Like, you can't just go in there and peep your head in if you're not dressed.
Right.
It was like, you have to really be cautious around her.
Right, for sure.
Yeah.
Tasha, what additional tips, hints, or advice do you have for somebody that has been recently diagnosed with a chronic illness?
Additional advice?
Yeah. Before we wrap this episode up, any advice you've got for chronic illness patients out there?
You gotta have I know people look at me when I'm crazy when I say this. You gotta have a ear mask that you have to learn how to make things out of a joke, but not too jokey. But like you really do.
Keep a positive attitude.
Well, yeah, you got to keep that positive.
Yeah, either you're
one
laughing
day
or crying.
Right, that's what TikTok is helping you do, right?
I was one day I was in the hospital and the lady next to me, I think she got upset because somebody was like, well, how you doing today? And I was like, well, I'm doing fine. But my gut is one different. They got an attitude problem. So I don't know.
Right.
You got to ask my, and she looked at me like, that's not funny.
Oh.
I'm like, what? It is.
Yeah,
and
it is funny.
Like,
yeah.
This is what she do. This. She was like, then after a while, she noticed how I was talking and she was like, oh, okay, you do have a good way of looking at life. And I was like, life can get you down. You have to. I said, when you go to the hospital all the time, and this is one thing also, positive. If you go to the hospital all the time, or go to the doctor, and you go in for one thing, and you're going to probably come out with something different on your chart list. Let's say you go in for your gastroparesis or your Lambert Eaton. You're going to come out with probably heart problems, or it's going to be something else on your diagnosis that they figured out while they was testing.
Right.
I was like, so you gotta be, your mindset really have to be strong enough. Like you cannot just go in there with an attitude or go in there with, you can't let it get to you, because trust me, I went in there, I come out with a feeding tube. I was hurt. It took me a long time to get through that. I didn't want to be bothered. I didn't want to talk to people. I didn't want to learn about it. I didn't want nothing for 2 weeks. But I was like, one day I just woke up and was like, you know what? And my daughter and them heard me. And I was just in there doing everything I had to do with the feeding tube. And she came in, she was like, oh, she's using it. And she just looked at me. And her and my dog, they just looked like, well, so people like, how do you go in there? How do you stay happy? I'm like, if you go in there with that attitude that, oh, I know they're going to find something else, that's the attitude you want to have. I go in there, I pray before I go in there. I was like, I tell them what's going on. I'm like, I like, it also depends on your care team. Because if your care team, they don't really talk to you, or they don't explain stuff to you, of course you're going to go in there. I mean, you're going to feel some type of way. I said, but they tell me, even when I call my doctor and I'm like, well, I got to go to the hospital, they're like, pack an overnight bag just in case. So, yes.
Well, Tasha, thank you so much for joining our show today. I mean, you've shared a wealth of information, and I'm sure that there's so many people out there that want to hear more about your story. So how can listeners learn more about you?
And see how adorable your service dog is.
Can you share your TikTok account with us?
So I have.
Oh my gosh!
There goes
I'm
my
so
dog.
sorry.
Sorry, we got a delivery, I guess.
Yes.
Hold on 1 second.
1 second, sorry.
Let me go get the delivery.
Okay. Why did you get a delivery today?
It was the cart that you ordered for the dog.
Oh, okay. Sorry, we have a dog with a bum hip, so he has a new cart so that he can take walks, which means we actually pull him around the neighborhood. Well, we are going to, because as of right now, she'll just lay down, and she weighs 100 and something pounds, and we just kind of sit there and look at her until she's ready to get up again. So I guess her cart just got here. But okay. Okay, go ahead, Tasha. How can people learn more about you and your amazing TikTok videos?
So my TikTok is Sassy Tasha 79. Instagram is Tasha Denise.
Okay.
Facebook is Latasha Denise DeRamus. I mean, this is all.
Oh, okay.
Latasha Denise DeRamus. The best way is either TikTok or Instagram.
Okay.
I don't need to be on Facebook.
And TikTok is Sassy Tash. Sassy Tash 79, right?
Yes.
All right.
We'll make sure that we put links for those on our website as well.
Yes.
Yeah.
And thank you, Tasha. We're going to wrap this one up.
Because we're running out of time.
Yeah,
but
we're going to get cut off on Zoom.
Does it just close off?
Yeah.
Why?
I don't know. If you have any questions or comments related to today's show, you can contact us at PodcastDX@yahoo.com, on our website, PodcastDX.com, on Facebook, Twitter, Pinterest, Instagram, or TikTok.
And if you have a moment to spare, please give us a review wherever you get your podcast. As always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, and always seek the advice of your physician or the qualified healthcare provider with any questions you may have regarding a medical condition and treatment, and before undertaking a new healthcare regime. And never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.